Hi, I'm Josh, a PhD student from the University of Liverpool studying deep learning for prognostic modelling. Prognostic models are commonly used to predict the future outcome of a disease or condition. In clinic, patients often have images such as colour fundus, OCT, or X-rays taken at multiple visits. We want to use these images to construct a prognostic model. There have been some recent works using deep learning to predict disease progression with longitudinal images. Two papers propose using a CNN followed by an LSTM. Both of these methods require even time intervals between visits. This is unrealistic in practice, as patients are likely to skip visits or clinicians may choose to change the screening interval. Last year, we proposed interval scaling. This allows for uneven time intervals, creating a much more practical method. However, all of these methods rely upon some kind of RNN. These RNNs are often computationally complex, requiring a large amount of computing power. They can also suffer from the vanishing gradient problem. We propose an alternative which takes inspiration from time series analysis. Without the RNN gates, this method is much more computationally efficient. We use vector autoregression to predict what the future feature vector may look like. The aim is not necessarily to beat the state-of-the-art performance, but to create a more computationally efficient alternative. The regular VAR is a linear model which uses previous features to predict the future feature vector. The previous feature vectors at each of the n time points are combined, and this produces a feature vector for the n+1 time points. We add the previously proposed interval scaling to produce a model which can account for uneven time intervals to produce the scaled VAR. The overall framework looks like this. We take a number of previous images and pass them through the CNNs with shared weights to produce a feature vector for each image. The feature vectors are fed into the model shown in the last slide to produce a potential future feature vector. Finally, a density is used to give a probability of progression. To demonstrate the method, we used the age-related eye disease study, the current largest study into AMD. We aim to predict progression from early or intermediate to advanced AMD. We used 3 previous images to predict progression by a 4th visit. Results show that the method using both VAR and scaling significantly improves AUC and specificity with a non-significant loss in sensitivity. The ROC curve is shown with confidence intervals. We can also see here that there is a significant improvement in specificity for the VAR with the scaling method. This is often desirable in screening settings. Decision curves can be used to show the net clinical benefit of a model. A model is considered better if it hits 0 net benefit at a higher threshold. We can see here that out of all the models shown, the VAR with scaling hits 0 net benefit at a much higher threshold, indicating that this method provides an improved net clinical benefit. Class activation maps show that the model is identifying correct areas of the image by looking at the diseased areas. In conclusion, our model is able to predict disease progression. Here we have proposed an alternative to RNNs, which only uses a linear model. The method provides good discriminative performance and good clinical benefit. Although the aim was to create a more computationally efficient method, the model still needs to be compared with previous methods in future work. We also want to look at the feature vector produced by the VAR to assess whether it is close to the feature vector of the actual future image. So, we have developed a method to predict disease progression which is more computationally efficient than the previously used RNN methods. I would like to thank my funders.